Hi, my name is Lisa Copen, and I am the founder of Rest Ministries, a Christian organization that serves people who live with chronic illness or pain. I have had rheumatoid arthritis since 1993, and am here doing a series of short videos about my recent experience with joint replacements in my hand. I thought a patient perspective might be helpful for those that are going through it. And so if you are planning to go through any kind of joint replacement or considering it, this might be helpful for you, especially if it's in your hand. I went to the surgeon and consulted with him, and he agreed that he would do a replacement. Actually, after he got in and saw the joints in my hand, he said there was more disease present than even he had imagined from the x-rays. So he did replace all 4 knuckles in my left hand, and within 8 days I was at the physical therapist to start therapy. They said it was going to be quite a project, and I did expect that. I have to say my pain level wasn't nearly as bad as I thought. I did take Percocet that first week on a regular basis in addition to my other rheumatoid arthritis medications, and then started weaning myself off of that. The rheumatologist, the physical therapist, said to just take it occasionally when needed, maybe especially before a physical therapy appointment or at nighttime to sleep. So I got to physical therapy, and the therapist took off all of the bandages, like the ACE bandages and the wrappings and all of that off of my hand, and made me a splint. And what she does is get out the plastic and then heat it up and shape it around your arm. And I have to say, at first I was a little bit horrified of what it looked like. But I'm also the mother of a 6-year-old son, and what I also kept thinking was he is going to think this is so cool, because it resembled something like C-3PO from Star Wars. So this is basically what I walked out of there with. I am out of the splint now and into a different one, and I will go through the progress of these in the videos if you'd like to watch. But basically, the plastic is under here. This is the hard part. And you wear the little sock on your hand, and this fits over the hand. And although this looks like there's actually metal coming out of my hand, it isn't. It's all disconnected. The wound was 1 cut all the way across below the knuckles, which is amazing what they can do to replace all 4 joints with 1 cut. It is great to be able to see the therapist. I saw her 3 times a week for about 6 weeks, and so she was able to keep a good eye on the wound and tell me how it was looking, if she had any concerns. When you're on any kind of drugs that suppress your immune system, like I'm on 20 milligrams of prednisone right now a day, which you may be able to tell from my face, it slows down the healing of everything. And I was hand sanitizer queen because last year I had a wound in my ankle, which was it ended up just being a nice clean wound with no infection, and within 24 hours I had the flesh-eating virus and was in the hospital for 7 days. So I was very scared about infection and kept an eye on that, and they kept that covered really well, and the stitches came out within about 2 weeks. But the splint that they actually made, it has a lot of Velcro on it. As you can see, all this is Velcro, and then each of these are little slings for your fingers. This is called an Outrigger Splint, and there's a lot of metal. And the first appointment I have with the therapist, I was probably there at least an hour and a half, because she builds this entire thing, and whichever therapist you have will build you something. It may be slightly different, but the odds are it will be some kind of Outrigger Splint, because the goal of what they want to do is to keep your fingers out here, which feels very odd after you've just had 4 joints replaced, to have them just kind of dangling out here. But the goal is to keep them exactly where they're supposed to be with the level of your joints, while also being able to do the exercises. And you start out doing exercises. I did it where you'd push down as hard as you could and hold it till 10 seconds, and then pop it back up, and then push down and hold it again. You'd go through each one, do the curls. I could barely curl at first. And it can be discouraging, but just know that it's just a matter of time. It'll take time. And then what happens back here, all of these are Velcroed So they're exactly where the therapist wants them. I can only move this now because I'm no longer in the splint. But just the millimeter of difference can make all the difference as far as where your fingers hang. So you won't want to mess with that. Now this is an excellent thing to be able to wear if it's Halloween time, because you will scare everyone you're out with. It's very odd looking. It takes a while to get used to. I have to say, for me, I have bad shoulders that are disintegrating from the arthritis, so the weight actually was not nearly as bad as having a heavy cast on. I know they call those casts now a splint because you're not completely enclosed in it, but when you take something and wet it down and it turns hard, and then you put 3 pounds of padding on it, it's very heavy. It feels like a cast. And I would say this part here, see, is plastic. There's a lot of Velcro, a lot of things they use to form your hand. Make sure that you ask your therapist, your surgeon, your rheumatologist, whoever, to find a really good therapist who will work with you and who understands rheumatoid arthritis, if that's a disease you're dealing with, because you do want it to be comfortable. You don't want it to be painful. It shouldn't have to be painful, although comfort is a relative term. So you're going to be uncomfortable, of course, but you don't want something that's jabbing you or putting a lot of tightness in some area where it should not be. And then what they do is they tighten these, they readjust these, so you really do have to go to therapy as often as they tell you, because things can change just overnight with your hands and they want to readjust. One of the most difficult things for me is my therapist was about 45 minutes away. That was the closest one. And so driving is, you don't get to drive. Even if you could physically drive at some point, you can't drive with this on. Just imagine if this got caught on your door handle as you were steering the wheel, you'd be a mess. So for me, that was one of the most difficult parts. My mom came to visit, and she was my chauffeur for a while, but she didn't like taking freeways, so we did a lot of back roads. And therapy was a 3 to 4 hour commitment every time I went. It was about an hour up there, about an hour back, and then an hour to an hour and a half there. So it is a commitment. Plan on making your therapy a major priority and factor in your life when you do that. You do get to wear this 24 hours, 7 days a week. I will show you in the next video the one they made me at nighttime to wear that I wore some of the time as well. But actually this one wasn't too bad. Because of my rheumatoid arthritis, I sleep in odd positions, and so a lot of times my hand might be sticking up in the air anyways. This gets caught on the covers and that kind of thing. But they did say, as far as fingers, I couldn't really damage them in my sleep. That if I hit it hard enough, the pain itself would wake me up before I would do damage. One of the benefits of joint replacement is they actually take the nerves out of the tissues surrounding the joints, so you don't actually have pain from the nerves in the areas that they put new joints in. So I have to say that was a pleasant surprise, and although you may feel like you're losing some body parts, if you lose occasionally some of those tendons or tissues or whatever that tell you you're in pain, that's not necessarily a bad thing. So I'll be back in the next video to show you the nighttime splint, and if you'd like to visit our website, it's restministries.com. Thank you.